Hey, so it's not actually cool that Alabama has no OBGYNs in many of their counties. Actually, not pretty cool that they have had to rely on external funding to fix a problem that should have been fixed decades ago. What was Dr. Oz referring to when he said they're actually having robots do ultrasounds on these pregnant moms? I was curious because, hi, I'm a fourth year medical student going into become an OBGYN. I actually have worked through UCLA's hospital system. I have never seen a sonographic robot. So this is what he was talking about. He's referring to Alabama's plan to use a sum of the $203 million it was awarded under the federal government's Rural Health Transformation Program. In its proposal, Alabama said it hoped to provide telerobotic ultrasound systems. Essentially, you still need a sonographer or an operator to perform an ultrasound from a remote location. But then what you need is an OBGYN to interpret those results. You would also need access to a labor and delivery unit. If something were to be wrong with those results, you would need access to an obstetrician to see in clinic if something were to be wrong, and you would need access to a hospital. Unfortunately, they don't have those either. More than a third of the state's counties are considered maternity care deserts, meaning there is no access or limited access to hospitals with labor and delivery units, birth centers, or obstetric providers. About 28% of women in the state had no birthing hospital within a 30-minute drive of their home, compared to the national average of 9.7% of women. Alabama has the third highest maternal mortality rate in the country, and it ranks near the bottom nationally in the number of doctors per patient. For every 100,000 residents, the state has just 241 primary care physicians, placing Alabama 45th among the states. In 2021, after the overturn of Roe v. Wade, applicants for OBGYN residency programs in the state dropped 21.2%. I'm applying into OB-GYN. Alabama has a killer program. They're very good at what they do. Doctors can't live with the moral injury of sending their patients into these maternity care deserts, of not being able to offer them pregnancy terminations, should that be the route that they either A, want, or 2, medically need. And doctors themselves don't want to live in a place where they can't get the full spectrum of reproductive healthcare options. We don't need robots. We need to actually invest in our healthcare system. We need to not bankrupt people for getting healthcare, and we need to properly invest in basic infrastructure.